Welcome po sa ating sesyon, ang ating pong webinar ngayong hapon. Ito po ang Mental Health and Psychosocial First Aid. Ayan. So, maraming salamat po. Una sa lahat, maraming salamat po sa inyong interes na makilahok dito sa ating pong webinar. Ito po ay naging inisyatiba ng UP Diliman Gender Office bilang bahagi ng aming mga aktibidad. Actually, ito po ang una sa aming major activities para sa UP Diliman Pride Month 2020. Ayan. Na may hashtag po na hashtag UPD Pride Online 2020. And first time po na lahat ng aktibidad ay online ngayong taon. At syempre yung aming pong tema ay Tuloy Ang Laban. Ayan. Dahil naniniwala po ang Diliman Gender Office na anuman pong circumstansya, anuman pong mga hamon sa atin, anuman po ang ating mga pinagdadaanan, ang laban natin ay nagpapatuloy lamang para sa LGBTQIA++ community at para sa ating bayan. Ayan po. So ito po yung mga paksa na tatalakayin. Okay? Tigto 45 minutes po ito. Mental health and the law na ibibigay po sa atin, itatalakay sa atin ng ating legal consultant and counselor na si Atty. Alnie G. Foja. Ang susunod pong sesyon pagkatapos niyan ay ang mental health services in times of pandemic and disaster. Ang magiging tagapagsalita po ay si Professor Don E. Gaba. Siya po ang aming counselor, isa sa aming counselors sa UP Diliman Gender Office. At ang panghuling sesyon ay Psychosocial First Aid. At ang tagapagsalita po ay si Salvacion Shoot D. Pascual o si Tita Shoot. Siya po ang aming Emergency Crisis Counselor sa UP Diliman Gender Office. Okay? So, syempre ito po yung mga paalala para po sa ating mga participants. So, ito po yung magiging balangkas rather ng ating pong magiging session ngayong hapon na ito. So, paunang salita, ayan po, mamaya, surprise kung sino. Tapos, tutuloy po sa una't pangalawang paksa, ayan, yung kanina kong nasabi. And then may video lang po, may video sa mental health in the time of COVID-19. Tapos magkakaroon po ng 10-minute break. Okay, dito na rin po tayo magsisingit ng group photo kasi baka mamaya malagas na tayo. Yan. Tapos, after po ng break, yung ikatlong paksa, which is Psychosocial First Aid. Tapos, doon po tayo magpo-proceed sa malayang talakayan bago tayo magwakas. At sana'y maraming natutunan ngayong hapon na ito. Okay, tayo sa unang bahagi ng ating pong session ngayong hapon na ito. Para po magbigay ng pambungad na pananalita, kasama po natin ang aming officer in charge na si Cristel Gomez Magdarao.
Ayan. Hello, Gio. At hello po sa lahat. Ayan. Surprise. Ayan. So, busy nag-a-admit no, ng mga papasok pa na mga nag-sign up dito sa ating activity. Ayan. So, muli, magandang tanghali no, sa ating lahat. No? Una sa lahat, maraming salamat sa lahat ng nag-join dito sa ating Mental Health and Psychosocial First Aid Orientation. Actually, itong activity na to ay unang na-conceptualize sa ilalim ng aming previous coordinator, si Dr. Nancy Kimbel Gabriel. No? Actually, ang original design nito ay isang training na ang layunin ay makabuo ng isang support group. Kasi sa obserbasyon ng aming opisina, karaniwan ng mga kaso, lalo na sa mga estudyante, ang kanilang mga kaibigan, kaklase yung kanilang unang sinasabihan. No? Pero dahil nga may mga pagbabago, dumating na nga yung pandemic at kailangan mag-transition online, ito ay conceptualize in a way na makakapagbigay muna siya ng isang orientation. Ayan, so nabanggit na ni Gio yung mga bahagi no, ng ating webinar. No? So yun nga, ang layunin nito ay makapagbigay ng orientation sa usapin ng mental health, no? At ang mga batas na may kinalaman dito, no? Paano ba natin haharapin no, yung mga stress na dulot nito at syempre yung mga batayang prinsipyo pagdating sa psychological first aid. Yan. So actually ngayon ay Pride Month, no? Para sa mga nakakalam. So happy Pride. Ayan. At ito actually ang handog din ng UP Diliman Gender Office na kanyang aktibidad no para sa pakikiisa sa LGBT community no para sa laban sa equality no at pakikiisa din sa mga national issues. Kasi ang nangyayari ngayon ay stress na tayo, 'di ba? Dahil sa nandiyan ng COVID no, pataas ng pataas araw-araw yung bilang, andiyan yung kakulangan ng mass testing, no, problema sa ayuda. atake sa malayang pamamahayag at actually pati yung pag-aassemblea, no, yung kalayaan sa pagprotesta at yung pagratsyada nga ng anti-terrorism bill or anti-terror law. Ayan, no. Pinag-uusapan nga namin kasi kanina lang ay yung isang aming partner na organization, ang Bahagi, no, sila ay nagprotesta at sila ay hinuli. So, every day na may mga stress tayong kinakahadap na mas lalo pang napapatindi nga ng pandemic, no? Yan. So, ito yung nilalayan na pag-usapan, no, sa buong less than siguro 4 hours na pagsasalita. And so, mahuhusay, no, yung ating mga tagapagsalita. Sila ay merong malawak, no, at malalim na karanasan, lalo na sa usapin ng counseling. Kaya inaanyayahan po namin ang lahat na magtanong, no, magkomento, at magbahagi lang, no, ng mga nais nilang sabihin. Yan. So, bago ko kayo ibalik kay Gio, no, binabati ko muna yung mga ibang staff ng Gender Office. Nandito ba sila? Nakita ko na si Cindy, no, Cindy Cabrera, Cruz Cabrera, ang aming GAD officer. Diyan ka ba, Cindy? Ayan, si Steph Andaya, ng aming Research and Publication Officer.
Magandang hapon.
Si ang aming admin, no, si Tita Connie Martina at si Wilfran De La Paz. Ayan. At syempre, yung iba po naming mga speakers ay bahagi ng DGO. And syempre, si Gio bilang aming SOGI officer. So, muli po, maraming salamat sa pagdalo, no. Happy Pride Month. Ayan, no, tuloy pa rin ang laban. Tuloy-tuloy ang laban. Maraming salamat, Gio. Back to you.
Okay, thank you, Cristel. So tama po si Cristel, no, tuloy lang ang laban at happy Pride po sa ating lahat. So umpisa na po natin sa ating unang tagapagsalita. Okay? So una po nating tagapagsalita ay ang legal consultant o legal counselor ng UP Diliman Office. Kasalukuyan po siyang nagtatrabaho sa Foja Law Office. Dati po siyang legal consultant para sa dating DSWD Secretary na si Judy M. Tagiwalo. At miyembro din po siya ng DSWD Executive Committee or former member nito. At siya din ay dating legal consultant ng Gabriela Women's Party sa House of Representatives. So, bigyan po natin ng masigabong reacts at palakpakan. Ito po ang ating unang tagapagsalita, si Atty. Alnie Foja.
Okay, so muli magandang hapon sa ating lahat at magandang hapon sa lahat ng nakikinig or nakikiisa sa ating talakayan ngayong hapon. Ako ay natutuwa at nagpapasalamat sa Diliman Gender Office sa pagkakaroon ng napapanahong talakayan na ito. Binabati ko rin ang aking mga kasamahang resource persons, si Tita Shoot at si Don, na mga kasamahan ko rin counselor sa Diliman Gender Office, gaya ng nabanggit ni Gio. Okay, so ang topic ko sa hapong ito ay tungkol sa mental health at batas, no? Pero dahil sa kakulangan ng oras, we are going to focus on Mental Health Act, okay, or on Republic Act 11036. Okay, so maiksing pagbabahagi lang. When I was growing up in the province, I witnessed a person with mental health disorder chained and confined in a small kubo. Okay? So, shocking yun sa akin eh. No? Parang, bakit siya nakakulong? And I was not really understanding why. So, growing up, sabi nila, buang daw siya. No? And that she had to be restrained for being a danger to herself and the people around her. But that buang got well and was able to integrate herself back into her family and the community. But not after having been chained and isolated like a mad dog for years. So, tingin ko, lahat tayo or marami sa atin dito sa talakayan na ito ay merong ganyang experience. No? In high school also, ang pinakamalapit na experience ko sa ganitong usapin ay yung pagkakaroon ng guidance counselor. Pero alam natin na pag na-guidance counselor ka, usually kapag napaaway ka or may ginawa kang hindi maganda. No? So, and fast forward naman dito sa panahon ng pandemic. Ako yung tao na malalim ang tulog at hindi problema sa akin ang tulog. But for some reason, well, I knew the reasons. May mga panahon talagang nahirapan akong matulog. Okay, and that led to a consultation kay Tita Shoot, which helped me a lot. Okay, so by way of opening the topic, okay, so nakakatuwa dahil that we are discussing this now ay ibig sabihin para sa atin hindi na siya tabu. Okay, for the longest time, ang usaping ito ay tabu. Kasi merong stigma na attached sa pagiging o pagkakaroon ng isang mental health disorder or mental health illness, at mayroon ding discrimination, okay? Because people with mental health conditions are often neglected, mistreated, and maltreated, gaya nung nabanggit ko kanina, discriminated, misunderstood, okay? When they seek treatment and get well, they are often stigmatized. Sadly, we do not understand mental health condition as an illness, for we only know illness to be physical. Pag sinabi ko na masakit ang ulo ko, masakit ang tiyan ko, madaling unawain yun. It's physical, no? I mean, yung tiyan, yung ulo, alam naman din natin yun. Pero pag sinabing na-aksidente yung isang tao at kailangan dalhin sa ospital, that's very easily understood. Okay? Some even take it for a curse, yung pagkakaroon ng mental health disorder. Others think nothing is really wrong and therefore pay no attention. And when they do pay attention, it is often already too late. Okay? So yan ang backdrop ng batas na ito. Yung campaign for a mental health legislation, because prior to the Mental Health Act, we did not have a mental health legislation. Ang earliest version ito was filed in the late 1980s by Senator Orly Mercado. At itong RA 11036 or the Mental Health Act nga, it took 17 long years to become a law, no, from when it was first filed in 2001. So, bago niyan, anong meron tayo? No? So, mental health in the Philippines before the passage of RA 11036. In terms of laws, we had scattered and fragmented pieces of legislation, actually portions lang of particular legislations. For example, the Revised Penal Code, Magna Carta for Disabled Persons, or yung RA 7277 as amended. Meron din sa Family Code, meron din sa Comprehensive Dangerous Drugs Act of 2002, or yung Republic Act 9165. For example, sa Revised Penal Code, yung imbecility or insanity exempts a person from criminal liability. It's found under Article 12. Okay? The arrest and detention by reason of insanity requiring confinement in a hospital is not considered penalty but as a measure of prevention. That's in Article 24. Execution of sentence is suspended when a convict becomes insane. Article 79. No? Sa RA 7277 naman, or yung ating Disability Act, restrictions or different abilities as a result of mental health condition is included in the definition of disabled persons. Kaya yung disability nga sa batas na yun, it is like this: a physical or mental impairment that substantially limits one or more psychological, physiological, or anatomical function of an individual or activities of such individual. So therefore, under the said law, mentally impaired or disabled persons are also entitled to the benefits of the law. Ang problema sa batas na yan, it seems, if you have had the chance to visit that law, it focuses on physical disability. Okay? Kahit yung mga interventions, yung accessibility, etc., nakafocus talaga siya sa physical disability. Okay. Ano namang meron sa family code natin? Okay? Sa family code natin, sinasabi psychological incapacity is a ground to declare a marriage null and void. Okay? That's in Article 36. Unsound mind is a ground to annul a marriage. That's in Article 45. Drug addiction or habitual alcoholism is a ground for legal separation. That's in Article 55 of the Family Code. Ano namang meron sa Comprehensive Dangerous Drugs Act? Sabi sa declaration of policy nito, it is declared the policy of the state to provide effective mechanisms or measures to reintegrate into society individuals who have fallen victims to drug abuse or dangerous drugs dependence through sustainable programs of treatment and rehabilitation. But alam naman natin kung anong nangyayari ngayon, no? People who are involved in drugs, including those who are addicted to it, na hindi naman sindikato, meron dyan sa kanila yung tinatawag nating drugs war or war against drugs ng ating gobyerno. So very criminal yung approach sa Dangerous Drugs Act. So talagang kulang dahil wala ngang legislation that focuses on this mental health issue. Yung ating National Mental Health Policy before this law was found in Administrative Order Number 8, 2000 pa yan sa panahon ni Secretary Dairit. Yung Mental Health Authority at that time, it's the National Program Management Committee of the DOH. At ang budget, Gio, pwedeng paki-move, okay, next, sa budget, okay. Budget is only 5% of the total health budget. Meaning to say, yung budget ng DOH, only 5% of that goes to mental health. Okay? And about 95% of that 5% is spent on the operation, maintenance, and salary of personnel of mental hospitals. Yung ating National Center for Mental Health in Mandaluyong, and meron din sa Cavite, no? Cavite Center for Mental Health, and yung sa Mariveles Mental Ward in Bataan. So, ganun yung estado natin. Insurance coverage, move up, Gio. Okay, PhilHealth covered mental health illness, pero limited lang siya to patients with severe mental disorders that required confinement for short duration. Okay, mental health workers, only 700 psychiatrists and 1,000 psychiatric nurses, for a population of more than 100 million. Okay? More than 50% pa of psychiatrists work in for-profit mental health facilities and private practice. So, ganyan kakulang yung mga workers natin sa field na ito. What about, I'll fast forward para makafocus tayo sa batas later, no? Access to mental health facilities. It's not even across the country. It favors us living in the National Capital Region kasi nandito yung mga major hospitals and also yung mental hospitals na nabanggit ko kanina, yung dalawa. Okay. And moving forward, statistics. Okay. Very disturbing statistics. 1 in 5 people suffers from a mental health problem. Okay. Between 17 to 20% of Filipino adults experience psychiatric disorders, while 10 to 15% of Filipino children aged 5 to 15 suffer from mental health problems. So, andyan yung statistics nyo, makikita nyo dyan. Move up, Gio. Okay. So, I'll run through this na lang. Okay. Pero I'll pay attention to this. According to the latest numbers from the new Philippine Health Information System on mental health, schizophrenia is the top mental health problem in the Philippines. And most that are affected are male, Filipino male. No? Makes you wonder, no? Kasi siguro, ako lang, I think it's part of the reason is that toxic masculinity, no? Alam natin. Other mental health disorders in the list are depression, anxiety disorder, schizoaffective disorder, acute and transient disorder, and stimulant-related disorders. Suicide is another creeping problem in the Philippines. In 2012, 2,558 Filipinos committed suicide. And of this number, 2,009 were males. That's why you will see in this law, there's a specific section, no, that talks about suicide prevention. Yung data natin, fragmented. Okay? And treatment given to those needing mental health treatment, involuntary admission, and the use of restraints or seclusion are common. So, ang mga data na yan ay hindi ko po gawa-gawa. No? Yan yung source ng data na yan, naka-flash dyan sa inyong screen. Okay. So, yan ang background ng Mental Health Act na ito. Okay? So, let's talk about the law itself. Okay? RA 11036, which was signed on June 20, 2018, took effect July 5, 2018. Okay? Actually, may IRR na ito. Ang IRR nito ay napirmahan recently lang or only a year ago, January 22, 2019. So you can say that this is still a work in the making, no? Ang short title, as I have been mentioning, Mental Health Act, but the full title, which gives you an idea what this law is about, is an act establishing a national mental health policy. So we now have a national mental health policy for the purpose of enhancing the delivery of integrated mental health services, promoting and protecting the rights of persons utilizing psychosocial health services, and appropriating funds, okay, and for other purposes. Okay, so what I did was to come up with a list of the salient features of this law, okay, and you will find this in different parts of the law, no? So it's good also if you yourself can visit the law after nitong webinar na ito. Number one, gaya ng nabanggit sa title, no? This law established a national mental health policy. Okay? And if you have a national mental health policy, basically this is what is going to be your guide, your roadmap kung paano mo i-implement yung pagtataguyod ng mental health ng mga Pilipino. So having said that, this policy underscores the basic right of all Filipinos to mental health, focuses on improving the mental health of the population in schools, workplaces, and communities. So later, we will be discussing kung ano naman ang dapat gawin ng mga educational institutions and even workplaces or companies, employers. No? It promotes a balance between community-based and hospital-based delivery of mental health services. So related dito yung usapin na, i-institutionalize na ba yung ating National Center for Mental Health or yung mental hospital, no? Bakit may focus sa community-based delivery of mental health services, no? There's also a focus on persons with psychiatric, neurologic, and psychosocial health needs. Kasi kagaya nung nabanggit kanina, yung mga batas na nabanggit ko, although may paunti-unti, negative pa nga yung karamihan, no? Hindi siya nakafocus dun sa psychiatric, neurologic, and psychosocial health needs ng mga Pilipino. Okay. National health policy that is also directed at overcoming society's attitudinal changes, yung stigma elimination and anti-discrimination. No? Napakahalagang usapin. Okay? It ensures provision and protection of all rights of service users and other stakeholders. So, ina-address dito yung involuntary confinement, yung basta-bastang pagbibigay na lang ng gamot, treatment or procedure. Okay? So, because here in this law, service users have rights, okay? And those rights are protected. Okay? And last but not the least, in fact, the most important, is the state compliance with all related local and international laws on mental health. So that is why what this law does is to specify the mandates of the DOH. The DOH being the primary government agency that implements this law, and other government agencies, no, secondarily, to mention DepEd, CHED, even the CHR is included here. Okay, so that's the first salient feature ng batas nito. Okay. It sets a national policy on mental health. Number two, it created the Philippine Council for Mental Health. So may bagong opisina. Ito yung PCMH, Philippine Council for Mental Health, which is now the policy-making advisory body. So ito yung magde-develop ng National Multisectoral Strategic Plan for Mental Health. At siya din ang magpapalabas ng mga guidelines para sa mental health program na kailangang gawin ng mga educational institutions and employers. So this discussion actually is very important, and I'm glad that this is spearheaded by the Diliman Gender Office, because this is actually one way of UPs complying with the requirements under the law. No? Kaya natutuwa ako kung maibabahagi ko lang sa inyo na ang bago nating chancellor ay talagang mayroong sapat na focus sa usaping ito, no? Mental health. Okay. So ang PCMH, chaired by the DOH, and it has different government departments under it as members. Mahalaga ding malaman na may representative dito ang academe. Meron din ang medical or health professional organizations, and ganun din NGOs involved in mental health issues. You know, we just hope that their voices will be heard in the council. Okay, number 3. Okay. So number 3 salient feature, it created a DOH mental health division. Okay, so basically mayroon na tayong Philippine Council for Mental Health. Meron pang specific office na create sa DOH, pero sa ilalim ito ng Disease Prevention and Control Bureau. Ito ngayon ang magiging secretariat ng PCMH. Okay. So next, it integrated mental health in the educational institutions and in the workplace. So ito yung sinasabi ko kanina, no, na sa batas na ito, may mga kailangang alamin na ang mga educational institutions, pati na rin ang mga employers. Kasi may kailangan siyang tuparin o sundin sa batas na ito or i-implement. 1, meron dapat na age-appropriate content pertaining to mental health. Okay? Kailangan itong integrated sa curriculum at all educational levels. In fact, dun sa IRR na pirmahan last year, sabi within 2 years, okay, from the signing of the IRR, so 2021, yung age-appropriate content for the promotion of mental health and prevention of mental health condition shall be made available to all educational institutions at all levels from preschool to postgraduate. So ito yung kasama dito yung mga values formation, pag-uusapan din ito sa science and homeroom, no? Siguro baka kasama na rin dito yung, I'm not just very sure, yung usapin ng pagbabalik ng good manners and right conduct siguro, no? Ayun. Pangalawa ay yung psychiatry and neurology now will be required subjects in all medical and allied health courses, including postgraduate courses in health. Okay, so required na yung psychiatry and neurology. If you're taking up nursing, if you're taking up medicine, no, and other postgraduate courses in health, kahit yung sa mga public health na courses. Okay. I think nabanggit ko na rin kanina, mandated na ang educational institutions to come up with mental health program in accordance with general guidelines that will be set or issued by the PCMH or by the council. Okay? So, ano yun? You know, programs on raising awareness on mental health issues, identifying and providing support and services for individuals at risk, facility access, no? Kasama na rin yung referral mechanisms. Like for example, if you're a student in UP and you are suffering from a mental health condition, you should be able to know where you are going to go. No? Parang sa sexual harassment, ganito yung magiging implementation. On the issue of sexual harassment, we have the Office of Anti-Sexual Harassment. Okay? And basically, yung pamunuan ng UP knows what to do on cases of sexual harassment. So ganito rin ang mangyayari. No? Kailangan na merong malinaw na programa on how to address mental health of UP constituents sa UP or sa ibang instituto, sa ganun din sa ibang schools. No? So kaya talagang napapanahon na mayroon tayong diskusyon na ganito. Okay? So kasama dyan, of course, kailangan mayroong mga staff, mayroong professionals, no? Mental health professionals. Kasi kung Kung mandated pala yan, mayroon kang mental health program, ay kailangan mo ng mental health professionals. Sino yung mga yon? Medical doctors. Pero hindi lang medical doctors. Kasama din dyan yung mga psychologists, nurses, social workers na trained on mental health issues or providing mental health services. Okay? So malinaw to, no? Nakasulat dyan, all public and private educational institutions shall be required to have a complement of mental health professionals. Pag sinabi mo complement, parang ang dami nun, ano? So, yon. Okay? Pati yung mga employers. Okay? Employers shall also develop appropriate policies and programs on mental health. So, ganun din sila. Meron din sila dapat na mental health program. So, kailangan din natin silang ino-orient tungkol sa batas na ito. Ano yung minimum requirements sa kanila kaugnay sa batas na ito? Pati na yung IRR ng batas na ito. Okay? So, paano yun? Paano yung pag-correct ng stigma and discrimination associated with mental health condition? Tsaka yung discrimination. You can no longer not hire a person just because nakita mo sa resume niya, or nalaman mo na meron pala itong treatment on his or her mental health condition. So that is a form of discrimination under this law. Okay? All right. So meanwhile, private health facilities are also tasked to have internal review board. Okay? Ano yung gagawin ng internal review board ng mga private health facilities? Kailangan nilang i-review yung mga cases, yung mga disputes and controversies involving treatment, restraint, or confinement ng kanilang service users. Okay? Parang, di ba, sa pelikula napapanood natin yung mga service users o yung mga patients, basically, ay binibigyan ng mga treatments or pills na hindi nila alam kung ano yung effect sa kanila. Okay? So basically, itong batas na ito ngayon, kailangan nilang magkaroon yung mga private health facilities offering mental health services. They need to have internal review board to review kung tama ba yung mga treatments na binibigay nila, kung mayroon bang mga reklamo sa kanila, i-review nila lahat yan. Okay. So next salient feature of this law is it provides for the rights of service users and other stakeholders. So hindi ko na iisa-isahin yung rights dito, no? Malinaw naman yun at madaling intindihin sa batas. Okay, but suffice it to say that under this law, service users, ito yung mas kilala nating patients, kumbaga, service users have all the rights, no, that we all have in the Constitution, as well as other laws that we have, and international laws as well. At isa sa pinaka mahalagang tandaan dito is they have the right to informed consent to treatment. Before you provide treatment to a service user, you have to explain what this treatment will do for you, what will be the consequences, no? The whole range of treatment available. At kailangang may say siya. Okay? Pati yung patient can have advanced directives, can say, you know, if it gets to a point that I'm not capacitated to make decisions on my own, this is the kind of treatment that I want, okay? Or I'm appointing a legal representative to decide on my behalf. Ang ganda, di ba? So, dahil hindi na ngayon yung mga service providers lang ang magde-decide para sa kanya. Eh, lalo pa siguro kung involuntary yung confinement. So talagang walang say yung service user. Sa batas na ito, na kasulat din yung rights ng family members, carers of course, and yung legal representatives. Okay? Take note lang that under this law, it is not automatic that the legal representative will be a family member. Okay? So, kung merong in-appoint na legal representative yung service user, the decision of the legal representative basically prevails over the decision of a family member. Kasi yung legal representative na yun is acting on behalf of the service user. So, hindi po pwedeng ako yung nanay niya and so therefore ako lang ang masusunod. no? Kung yung service user ay nag-appoint ng legal representative. Of course, the service user can appoint the mother or the father or a family member as legal representative. The usual, it needs to be notarized, and it needs to be also filed with the mental health facility. Okay. The law also spells out the rights of mental health professionals. Yung mental health professionals na nabanggit ko kanina na hindi lamang limited sa medical doctors. Okay. Next feature is it prescribed the quality of mental health services. So, hindi na ngayon pwede yung kung ano yung inisip ng kapitbahay or inisip ng mental health professional, ayun na ang ibibigay na treatment. No? Treatment or services need to be medical and scientific, responsive, appropriate, no, least restrictive, yung hindi yung ikukulong siya agad-agad, no? May mga instances, of course, extreme instances na restraint ay kailangan. Age appropriate, and most importantly, provided by accountable mental health professionals and workers. Later on, you will find that there's penal provision in this law. Okay? Okay. So mental health services should also include mechanisms for suicide intervention, prevention and response strategies with particular attention to the concerns of the youth. 24/7 hotlines shall be set up and existing hotlines shall be strengthened. No? Meron tayong ngayong helpline, yung sa Philippine version ng, well, I think sponsored din ng Natasha Goldberg Foundation. Merong hotline ngayon. In the IRR, there's a further elaboration on suicide prevention. So it says that the DOH is tasked to develop a national suicide prevention strategy as part of its national mental health program, which will include training of first responders, mainstreaming of suicide prevention in public health education, and establishing a system for suicide surveillance. So the suicide topic is taboo no more. No, it needs to be talked about openly as well as addressed. Okay, and kailangan ng mga first responders. So if there are people in this group who are interested in becoming first responders, kailangan. No? Okay. Next, it supports community-based mental health care. Okay, ano tong community-based mental health care? So basically, under the IRR, it's clarified na itong community-based mental health care ay ito yung anything that is outside a mental hospital. So any mental health care provided outside a mental hospital is considered as community-based mental health care. So I think ang ini-envision nga dito is yung home care, and dito pumapasok yung deinstitutionalization ng mga mental hospitals. Okay? But it's not like tatanggalin na sila. No? There's just going to be promoted a balance between community-based health care and mental health care and hospital-based. Okay? Right. In relation to this, no, yung community-based mental health care, every LGU is tasked to come up with their own mental health program. Okay? So, ang daming kailangang gawin sa batas na ito, basically. From top to bottom or from bottom to top. No? From the barangay, yung mga BHWs natin will have to be trained, no? To detect, to prevent, and to refer cases of mental health illnesses. So kailangan sa certain barangay, trained yung kung sino man ang kanilang aatasan para mag-implement ng kanilang mental health program, usually the BHWs, dapat may training sila as first responders. Or at least ma-detect nila kung sino sa barangay yung nangangailangan ng mental health treatment or referral. Alam nila kung saan dadalhin para makita nila na ano pala yung problem niya, mental health. Hindi ito isang problema lang na kailangang hindi pansin or na hindi dapat pansinin. Okay? So, ganun yung ini-envision ng batas na ito. Okay. Next, it provides for the minimum requirements for psychiatric, psychosocial, and neurologic services in regional, provincial, and tertiary hospitals. So, yung ating regional, provincial, and tertiary hospitals, kailangan na sila ngayon, according to this law, okay, lahat sila rendering service to patient clients shall provide psychiatric, psychosocial, and neurologic services. Ano yung mga yun? Pwedeng short-term inpatient hospital care in a small psychiatric or neurologic ward for service users exhibiting acute psychiatric or neurologic symptoms. No? Kung hindi nila kayang gawin yung lahat ng mga nakasulat sa batas, no? Pwede rin yung referral system involving other public and private health and social welfare service provider. So makikita mo na rin kaagad yung reading the law, makikita mo na rin kung alin yung pwedeng maging butas ng batas na ito. No? Kasi while on the one hand, yung mga hospitals natin, regional, provincial, and tertiary hospitals are mandated to have this, may option din pala sila na pwedeng referral system lang. No? Of course, unawaan naman natin because it really entails money. Okay? Kaya yung by way of comparing lang yung sa usapin ng women's rights, kinailangan natin na meron talagang gender and development 5%, at least 5% budget para ma-implement. Unfortunately, and I'm getting ahead of this particular topic na, unfortunately, dito sa batas na ito, wala siyang specific na fund allocation when it was passed na we are allocating 10, 20, 30, or 100 million for the implementation of this law. Wala. Ang funding for this law pa rin ay integrated sa budget ng DOH. So I think isa yon sa mga nakikita ko magiging kahinaan ng batas na ito, yung funding requirement niya. Okay, moving forward, 9, it spells out the duties and responsibilities of mental health facilities. Okay? So, yung mental health facilities ngayon, hindi na pwedeng basta-basta ka na lang mag-put up ng mental health facility for profit. Kailangan merong policies, guidelines, and protocols for minimizing the use of restrictive care and involuntary treatment. Okay? Kailangan i-inform yung service users of their rights. Kailangan i-ensure na informed consent is obtained. No? They also need to maintain a register on all medical treatments and procedures. Okay? At ang register na yon, it needs to include kung ano yung mga adverse reactions to the treatments or procedures. No? And they need to ensure that legal representatives are designated or appointed. Okay? And lastly, each local healthcare facility must be capable of conducting drug screening. Okay. 10, it spells out the duties and responsibilities of various government agencies. So kung titingnan mo yung batas na ito, makikita mo what DOH should do, what the council should do, what the LGUs should do, what the different departments should do. For example, CHED, CHR, yung CHR needs to have training on the rights of service users kasi nga nakita nila na kulang yung atensyon na binibigay sa pagrespeto ng human rights ng mga service users. So, nandyan sa batas na yan so that they can be held accountable. Okay. Number 11, it criminalizes the following. So, ito na yung nabanggit ko kanina. It is a crime if one fails to secure informed consent of the service user, unless it falls under the exception. So yung exceptions doon, temporarily, kung hindi talaga siya makapag-decide, no? Yung gano'n, or other instances, merong court directive, ganyan. Number 2, it's a crime to violate confidentiality of information. Okay, so this is also penalized under this law. It's also a crime to discriminate against a person with mental health condition. And number 4, to administer inhumane, cruel, degrading, or harmful treatment not based on medical or scientific evidence as indicated in the appropriate section of the law. Okay. Anong parusa nito? Imprisonment of not less than 6 months, but not more than 2 years. Or a fine of 10,000, but not more than 200,000 pesos. Or both, pwedeng both at the discretion of the court. And take note, if a government employee is involved or siya yung nag-violate ng mga penal clauses na ito, then pwede rin siyang kasuhan administratively. Okay? So pwede siyang masuspend, pwede siyang ma-fine, pwede pa siyang matanggalan ng trabaho. Okay, so lastly, I think I'm right on time. Challenges to the implementation of the law. So, no, hindi ako nag-specify ng mga challenges dito sa implementation ng batas na ito. But sa Diliman Gender Office din, meron kaming training na gender and the law. At ako rin na nagbibigay niyan. And one of the favorite topics that I discuss in that part of our training is yung substance, structure, and culture ng batas. Okay? Substance, we can say that the substance of this law, Mental Health Act, is good. Okay, in fact, it's a laudable piece of legislation. Okay, it's a landmark legislation. So substance-wise, I don't think we have so much an issue. Okay, siguro we will see later on. There may be rooms for improvement, but it is good. Okay, substance-wise. Pangalawa is culture. Okay, culture. How do we view people who have mental health conditions, or yung ating attitude towards them, or even towards the topic itself? No, are you ashamed to tell people that you have been seeing a psychologist or a psychiatrist? No, or that you have been seeking help? Diba, pag may sakit tayo, sabihin natin, masakit ang tiyan ko, hindi tayo nahihiya. Sorry, hindi ako makakapunta sa meeting natin dahil masakit ang tiyan ko. No? And that's very easy to understand. But how often do you find someone who tells another person na, I'm sorry, hindi ako makapunta sa ating meeting dahil inaatake ako ng aking psychological problem ngayon. No? In the aspect of culture, medyo wala pa tayo doon. No? Meron pa ring stigma, meron pa ring discrimination. Kaya nga maganda na yung discrimination talaga is penalized under this law. Okay? I think you probably have heard people saying, bago ka mag-asawa, tignan mo muna, i-check mo muna, baka may mental health problem pala yung pamilya niya. No? Okay? So may ganyan. Mayroon talagang kakabit na stigma and discrimination. But let's talk about yung last aspect of the law, which is the structure. Structure. Paano gagana ang batas na ito? And ito na yung buod ng challenges to the implementation of the law. How do you make this beautiful piece of legislation work? Okay? Will there be people who will render mental health services? Are we going to see enough number of Filipinos moving to the field of psychology or psychiatry, for example, or counseling, for example? Let's say a university comes up with a mental health program. Okay? Meron bang mga tao na gagawa niyan? Okay? How interesting is this field for us? And most importantly, of course, where is the money? Okay, is there going to be enough budget to implement this? Okay, 5% of the total budget of the DOH. Pwedeng malaki, pwedeng madagdagan, pwedeng hindi. But the fact na, as it is, ang dami nating problema. Even before COVID, ang dami na nating problema sa health sector. Okay? Saan lulugar ang budget para sa implementation ng batas na ito? Okay? And I think that is very, very crucial. Kumbaga, put your money where your heart is. So if we really want to see this implemented, then we need to have, for example, sa government, we need to have positions. We need to open positions, permanent positions, plantilla positions for counselors, okay? For psychologists, for psychiatrists, di ba? Ang nakalagay sa batas, a whole complement of mental health professionals. But you know, that will really entail money. Okay? And of course, kailangan din natin itong i-disseminate. Okay? We have to go down to the barangay level to tell people how to implement this law. Okay? We need to train first responders. We need to talk about suicide. We need to talk about toxic masculinity. We need to talk about anxiety. We need to talk about schizophrenia. And we need to talk what we can do about this problem. No? So, basically, hindi ito gagana kung wala tayong malinaw na estruktura kung paano natin ito pagaganahin. So bago pa lang naman yung batas, it's fairly new, especially that the IRR was just signed last year. Can give it a chance kung paano ito tatakbo, ano. But this webinar is a good start, okay? For UP and for all of us. So I think my time is up, and yun lang, at maraming salamat sa inyong lahat. Back to you, Gio.